Very good morning to everyone to join in today's section.
Good
So very
morning.
good DX and good morning to everyone. So
Good
I hope every
morning.
so everyone I hope everyone you will be happy today and healthier today. So as you know that now we are going very fast pace to the life. It's already July, going to be end of the July. So even the years is going on, but make sure that our progress is keep going with the years, and we should be rocking now. And the most important things in a DXN is our great health. That is the most important. So that is the one we should be take care now and forever until we die. We have to be in good health. So that should be our main foundation in DXN. After that, once your health is improving, then you try to share with people and what is the best benefit of our DXN products and all the health benefits. So by doing that, what we get, we'll get our wealth itself. That is the greatness of DXN system. So you see, DXN system is one of the best system in the world where I can able to take care of the good two things in our importance of lifestyle. So one is our health, another one is our wealth. So by doing that, we are caring about our health. The company is providing us a good wealth that able to be it become a legacy to the our entire people and our children and our grandchildren. This will be a generation to generation. So this is the best thing that DXN is provide to us. So first thing we have to know is we have to take care of our good health. Now we see that now the pandemic is really going very in a very high speed. So we got no choice that we have to take care of our health. So these are two things that DXN provide and our things that we should be take care. That is one is the toxin, another one is our malnutrition. This is the most important thing that we should tackle in ourselves. For that, DXN product has given you a great foundation and great way to solve this. So we should thank our founder, Dr. Lim Xiao Jun, to giving us such a wonderful company, such a wonderful product to us, so that we can able to tackle these two things that create all the problems. That is toxin and imbalancity of the body system due to our malnutrition. So for that, DXN provide us two beautiful products. Not only two, a variety of good products. The main important product is our Ganoderma. The Ganoderma itself is the foundation for all the removing the toxin from the body. So this Ganoderma help us the body to detoxify and balancing back our system. Another one, a wonderful product that given by DXN, that's called spirulina. Spirulina nourish our body with a good nutrient. Another one more important things in our life is a coffee and a tea. This combination of all these good products given us a very foundation of good health, which can able to enjoy by everyone in the world. So what we should do, we should take the product and consume it every day without a fail. Don't give excuses that health is our wealth. That is the most important thing. So for today, we are talking about how we going to improve our health and how we going to take care of our health. This is the Q&A section today. Today is our Q&A section. So how we going to tackle, and everyone in this here we can able to ask question and how DXN will help you to gain back our health. So today our panel will be our doctors and others leaders all will be participant and will giving out all the foundation, all the questions and answer will be given today. So for that we can start our program. So we introduce our doctor, Dr. Firdaus, for giving some words. Then we start with our Q&A section. Over to you, doctor.
Oh, thank you. Thank you. Hi, good morning. Good morning. Good morning, everyone.
Good morning, sir. Good morning.
So, all right. So thank you so much, Nixon, for the great introduction and start. Okay, today, quite some time we didn't have this English version of Q&A session. So today is the day, okay? So wonderful morning to every DXNS all around the world. So I'm Dr. Firdaus from Malaysia, being a medical doctor for 25 years, being an emergency physician for 15 years. And now my first profession is DXN. Why? Because health, wealth, and freedom. And that's the title today, Health, Wealth, Freedom Q&A session. So you may ask any questions based on this, okay? A little into business doesn't matter, okay? More into health is also okay. So I just have a little message for everyone. In this pandemic time, People are taking things very lightly. Okay, there is one thing that we need to strengthen our mind, and we have to be very aggressive in what we're going to do now for the future. You see, we're going to be more than 1.5 years, I think about 1 year, 10 months, most probably. We are already in this pandemic, and it'll go on and on and on. Okay. So for my thinking, I think will take easily about 5 years or what, but that doesn't matter. For the people who are not very concerned about the time, and this is okay, like for me and for my and other team members, they're pretty sure, and they are par with, they know what to do when it comes to health and also comes to wealth. But a lot of people are still hanging on and hoping that it will over very soon, and then we can get back to this and that, everything will be settled fast, and then sitting and resting and looking. You see, do not get wiped off in this hard time. Okay, this is going to be very hard. If you're not going to win the race, you'll be left behind. Don't know, in this 5 years or 6 years, whatever year, we may lose everything. We may lose our life too. So that aggressive it is. Okay. In Malaysia, we see the death rate is very high. I practically has lost almost about 12 good friends, a couple of 1 or 2 good friends. And day before yesterday, one of my very, very good childhood friend, his wife passed away, and today was the funeral. And friends among we know, just like hi, that sort of friends. We had almost 12 friends we lost in this COVID, and a couple of doctors too. Okay, so how many people? But the thing is, what I see here is, people are not taking things seriously on every aspect. When it comes to health aspect, they are not vigilant at all. They are very, very, not like sort of like no bother, they're so naive and not careful. Okay. And even like DXN, we have the best platform here to give you the good health, to give you the good wealth as well. But yet still, people are so reluctant to start and to move and, to go on. So this is the best platform. Believe me, I'm being a medical emergency physician. We have one cardiologist. Okay, we have accountant. We have so many different sort of people. Okay, in this platform, there is also a cardiologist. Why we choose DXN? Because of the relax and the residual income which we will create for our future. That is very important. You may be very healthy at young age. You may be running, jumping, everything you may do. But with one point, we will definitely get old. The days are passing, times are clicking, seconds is flying, but we will get old. Will you fit enough of flying, or crawling or jumping and all at the age of 70 or 80? Definitely no. What are you going to do? Will you have that kind of strength? If you're on the sales line, yes. In the young age, yes, you can do sales, 10 hours, 12 hours, you can drive there, here, you can do everything. But how long are you going to do that? You see. So this is something that very, very important. You need to think, and it comes to the health. Health is so important. Okay, why? You see, my wife, my friend's wife just said goodbye and go and, I get admitted and, I just can't breathe and things like that. That's it. 13 days, she didn't come back. I think 12 days or something, she didn't come back. Gone, that's it. Okay, so it's so hard to see all this. So we have to keep ourselves very healthy. If not, you or me, anyone, the health is bad at this point of time, we may lose, or we may just, gone missing in terms of that. So you want that to happen. You want to leave your families, you want to leave your children and everything behind. Okay. What can you do? How are you going to handle this? So this is where DXN is there. Okay. Build your health there. Build your health. Be vigilant. Know what to do for your health. Okay. And this point of time, we see a lot of information is coming. So much of information. Eat that, eat this, drink that, do this, inhale that, jump, quit, crawl, everything. This is good for this, good for this. You see, you got to understand the basic. What is the basic? Why do we eat? We eat because we get hungry. Why do we get hungry? Because our cells need food. Your cells need food, but your cells don't need fried chicken, Kentucky fried chickens, burger, hot dog, donuts, nuts, this and that. No, it needs nutrition. It needs essential nutrition, good nutrition. So you are nourishing them in a way. So this is what you got to do. So, but what we do, we are taste priority. We got stuck with the taste. So everything has to be tasty, nice, yummy. Chocolates, donuts, this and that they eat. Okay, this is the way we eat. Why do you hungry? Nobody knows. When you're hungry, just eat something nice. So this is what people happen. You see, why, there's so much of that, variants of different types of COVID is coming and people are getting, attacked and getting sick and many, because the immunity of the whole world is so poor, so down, pathetic. And this is why people are just getting globally you've been wiped off. So how are you going to save yourself? You see, the answer is only the immune system. What does the immune system need? Body is the best doctor. We all call that body is the best doctor. You see, we have the most so powerful module, which is DX. The mushroom, the king of herb, Ganoderma, spirulina, cordyceps, lion's mane, shiitake mushrooms, coffees, teas, so many different types of varieties. So you don't have to worry. All comes with abundant nutrition, good nutrition, essential nutrition. You do not have to do so much of research. Everybody has done, thousands of research there. Our job is so easy. Just buy, open, eat. Okay, if you don't have the money, okay, now everyone is so constrained, you see, money forever is not sufficient, not enough. How much you earn, okay, that is the world. Okay, you earn this much is not enough, that much is not enough. Okay, there is times you earn very less than what you're earning now, was sufficient, but now you're earning like 10-20 times more, but still not sufficient. So in the future, we're going to earn. Still no, you will create expenses to what you're earning. So that is life. So what you earn, you have to finish and enjoy and this and that and blah stuff. But now everyone is saying that, this is not enough. I don't have budget. Its choice is yours. So if you want to change, if you want to build, you got to change. You have to come out of the comfort zone. Even the health is the same. You see, all life gives us the same experience. Okay, you want to be healthy, you have to change your habit of eating. You're not moving, you have to move. You do not do any sort of exercise, you have to move, you have to carry yourself. The same thing goes to job. You want earning extra, you have to work harder, you have to create, do what you got to do and how you're going to create the legacy. And this is sort of trainings we are providing that for you to pick it up and build it, learn from all the leaders all over the world. In DXN, one thing's good blessing is, you see, he has situated in 230 over countries, and he has 70 over countries. We have physical office, we have so much of products, and every single language you can get the training modules. No excuses. You see, that's a beautiful part. But how many of you are sitting and listening? See, what is let's say today we only have 19. But the rest, they're all very busy. Doing what? I don't know, maybe doing something. You see, this is the thing. Okay, you got to build it. This is very important, especially the health. So first, gain your health. Then you also have the parameters to gain your wealth. And then it comes with the freedom as well. So we open the floor for the Q&A session. Let's hear from, what you all want to ask, anything on what is really the current issues, what is happening, what we should take, this and that, any sort of questions, what you all have. Please come. Even how to do sharing, how to, approach people, whatever questions. I'll try my best to answer. in the audience also we have Dr. Ranjan, Nemi, sir, Mr. Nixon, sir, and a lot of other senior leaders. Yes, everybody could share. Okay, their point. It's not only I am, it is not my show. It is not here only me going to answer. Everyone can, help to give your best here. Okay, so let's open the floor to, have your. Okay, you may put up your hand or you can unmute yourself also. I open the, bus that everybody could unmute yourself. So you can just click. Yeah, you may just click, unmute yourself and then you may ask question or even you can put in the chat box. Okay. Come on, don't be shy. If not, we have to call you.
Yes, I think. So you can ask any questions regarding with our DXN products, health problem, sickness, or anything you can ask now. So it's the right time to ask, so we can learn together. So you're able to know what is your problem, and we can able to help you. So you can ask the question now. So you can raise your hand. You can ask the question now, please. You can share it. If you want to share any testimonial also, no problem. You can share it now.
Anyone?
I think we have to pick up ourselves, sir. So there's any newcomer here today. You want to know anything about the accent, or you want to know it, or you want to share something, you can share now.
Good morning, sir.
Good morning, Agnes. Good morning.
Just wanted to ask, I'm having this arthritis problem.
Okay.
What can I take from the DXN, as I'm already taking spirulina now? I just started about 2 days.
Okay.
And I'm taking GL and GH, sorry. RG, sorry. And also Murunji.
All right.
Murunji, these are the things I'm taking.
Okay.
So is there anything else I should take or just go on with this?
How much you're taking now? How much you're taking now? And is it you're taking any medication outside?
No, I'm having diabetes also as well and cholesterol. That's the hospital medicine. I'm taking 500 mg metformin in the morning and 500 mg at night. And at night, I'm taking the cholesterol, the Simvastatin, half. Morning, I'm taking
okay,
together with metformin.
Okay.
That is for the sugar level, but actually much the hospital can help me.
Okay, I can't get it. I think the line is breaking. I can't get it, Agnes. Your line is breaking.
Oh. Sorry?
So never mind. It's okay. No problem. So you are still taking for your medication for your diabetic, is it?
Yes.
Okay. So how about your food pattern? So what is your taking now as for your lunch, your breakfast? So you should take care your food pattern now. I think as well as doctors always advise to.
Yes.
I think I let doctor to advise you. I think it's more champion on this. Doctor, can you advise on that?
Okay. Okay. It's very simple actually. First, are you overweight? Okay. If you are overweight, okay, that itself will put a lot of pressure on your bone, on your knee, on your ankle, everywhere, and the whole part. All right. So normally, in my experience, what I see is how do you get arthritis is because of malnutrition and too much of toxin. So it keeps your body to very much into closer to alkaline. And this alkaline issue, okay, it become it rips off or takes away all your minerals, calciums and all from your body to make it, to neutralize, make it, push it into alkaline. Okay, this is one way that you lose a lot of nutrition. All right. And also in our food, we are not getting enough nutrition. The food you should avoid, okay, everyone should avoid this inflammatory food,
Yes.
which is white flour, any sort of, bread, all these kind of things. And people have very bad perception towards rice. Okay. Rice plays the role. It is not the rice is the culprit. You can take a lot of good rice. It's the millet rice. They have, basmati rice. You can take one bowl of rice, no harm. Or you can change to, millet. There's so many other choice you have compared to rice. Okay, you can integrate, or you can take alternate days or something like that. Okay, there's so much of things. So this is one option. And then stop all the cookie stuffs and all this, cookies, biscuits, candies, cakes and all this stuff, anything to do with flour. And then also reduce or stop your sugar intake. Okay, sugar, brown sugar, white sugar, blue sugar, pink sugar, purple sugar. Now they have 1,001 types of sugar. Stop all the sugars, original sugar, fake sugar. They have also that. They say original sugar you can take. What do you mean by original sugar? Sugar is not our food. Keep it very low as much as possible. Cut the sugar 95%. Okay, so only 5% occasions is okay. If you come through any, parties, anything, you want to take 1 or 2 candies, fine. You can do that. Then you have a habit of...
So just now you mentioned about...
Come again?
Doctor,
Can you speak louder?
Doctor,
No,
just now you mentioned about the sugar. Your voice went in. I couldn't hear. You said all the colorful sugar, but then you said you can take this sugar. I couldn't hear that.
Okay.
Is it white sugar?
You don't take sugar. You keep it for occasionally, once in a while, you come for any functions. Okay, you cannot avoid a wedding, a birthday or something. Take very small amount. Okay?
Okay.
In a daily base, don't load yourself with too much of sugar. Okay, putting sugar for this, sugar for that, and some people go and buy this, original brown sugar, original from India, from Pakistan, from all these countries. Sugar is not our part of the food. That's it. Okay. Then you have a habit of drinking milk. Cut that off also. Milk is undigestible. Milk has a lot of problem. All these videos in my YouTube channel. Please subscribe the channel and also, use it. Okay, and that's very important. Subscribe the channel and see other videos as well.
Yes.
Okay, that's very important. And then what you can take from DXN? How DXN going to help you? Okay. What you can take from DXN, the entire range of the product is definitely suitable for you. So the most important here is RG, GL. You can take in terms of Richelium, okay, powder form, Morinzi, Codipine, VCO. VCO is very, very important for you. Virgin coconut oil. Then spirulina is a must. Okay, all these you take. And also, if you are in Malaysia, you can add Potenzi. Potenzi is very, very good for arthritis, rheumatisms and all.
Potenzi, is it?
Potenzi.
Yeah, potency.
Okay. That is really good. So you can take all this. Okay. And then provided, but you need to give a little time.
Yeah.
Okay. A lot of time needed. It depends. Time frame is all depends on every individual. Everybody is different. So work on it. Put your mind, heart, soul. Works towards the healing. Okay, that's very important. All right. And also myco-veggie is so good. Okay. You can also have myco-veggie with VCO with Morinzyme.
Yeah.
See, that will repair your colon, the small intestine, your stomach, and also you'll help you to lose weight. So all this, you cannot like focus one thing because this
kg, sir.
Come again? Yes?
I'm 52 kg. 52.
What is your height?
Height is 5.2.
Okay, 52. I think sort of like okay, but then work on the flabby areas and you need to build your muscle. Okay, muscle is very important. Okay, you're very young actually. Okay, 52 is very young.
Agnes,
But now 52 all looks like, 72 and,
I'm,
very unhealthy.
I'm not, I'm 65, sir.
65.
Yeah, my age is 65,
Oh, 65. Your weight is 52.
52.
Okay,
And my
fine.
height is 5.2.
Slightly overweight. Okay. But it's okay. Don't worry. Just follow what I told you. Use the micro veggie. All this will help you.
yeah.
Where you are from?
Ipoh.
Ipoh. You are under Mr. Nixon's
Ipoh.
group?
Yeah, Ramai group. Yes.
Mr. Nixon's group. Agnes, you called me that day, right?
Ramai.
Yeah,
Yes,
Ramai.
you called me the day, right?
Yeah.
Yes. Okay. Please consult with Ramai. They will tell you the same thing what I told you. I think Ramai is also here. She got the message. Please liaise with them. Mr. Nixon is there. They also will tell you exactly what I told you. Okay. In fact, I told you that day itself to talk with Madam Ramai regarding this. Okay. And also you have eyesight problem.
I already went for my cataract.
Yeah, it looks like you have a lot of problems. So discuss with them how to module this and then monitor on every area. You have arthritis, rheumatism, you have diabetic and also high problem. It's okay. Don't worry about all that. Don't worry too much. Okay. It is reversible. Work on it slowly. You're still young. 60 is still young, not old. Okay. You see, human body has the capacity to live for 120.
Yeah, correct.
And you're just reach 50% of it. Okay. But it's all the mistake is from the food. Okay.
Okay.
So inflammatory food. Stop Maggi. Maggi is a killer. Noodle is a killer. Okay. Milo, Nescafe is totally not food. Never ever take all this.
Stop the milk. All type of milk.
If you cannot get anything replacement, just drink water. Okay. No replacement. All right. I guess I answered the question.
Thank you, sir.
Okay. Thank you.
Thank you so much.
Yeah. Okay.
Okay. Any
You
other?
see, for us, the food is the medicine. So make sure we have a quality, a good essential nutritional food, which has therapeutical value. Okay. With very high medicine value. Like, wow, in Ganoderma, spirulina is the, world best, we can say, the complete food, okay, we'll say complete, and has more than 370 over nutrition in spirulina. This is very important. It's very good, very powerful. You can give for any kids, baby who is born, even a child, a baby can take this. You don't have to wait until they grown up and this and that. Okay, you can give them. And it's easy to digest. Okay, so it's good for iron, good for protein. It has such a beautiful protein, complete amino acids and all. So this is where the spirulina works very well.
Yeah.
So use that. Now, a lot of people are taking very poor quality greens. The greens which depleted with, so many different types of nutrition is missing. Nowadays, the vegetables looks more than a vegetable. It looks so big, so nice, so green, this and that. But when it comes to nutrition, very, very poor. And it comes with a lot of hidden stuffs, genetically modified. Yeah. We have to battle with all this area. So what is so difficult to just pop in like 10 to 15 spirulina a day, which is much, 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 much easy. Or at least 3 or 4 or 5, whatever you can. So that is the best. So you don't have to battle or, chase your kids or, to force them to eat vegetables. Spirulina is the best.
Yeah, correct.
So give spirulina to them and build the immunity. We have in powder form, tablets form, capsules form. It is so easy.
Yes.
You can sprinkle into your food. You can, your soups, Even a lot of people are drinking spirulina with coffee,
Yeah.
and in their yogurt, in their ice creams, and anyhow you want. It is a food. Okay. So any question?
So any other questions you can
You see,
ask
like
now?
today I had a member was telling they are mixing this RG and GL with boiling hot water. Okay, because they were telling that the upline told them this. Okay, and they said you can drink, take it with boiling hot water. I doubt they have not, they misunderstood the whole thing. What sometimes they may say warm water. Okay, for those leaders, do not say warm water. Tell them room temperature or plain water. A lot of people think warm water is boiling water. So when you go and put this RGGL in boiling hot water, you drop little of the efficacy there will be reduced. Why you want to lose that part? Everything is money.
Yes.
So just mix it with normal room temperature, normal water. You don't need boiling. It's not coffee.
Yes.
Okay. So just plain water is good. Whenever you mix the enzymes, also same. Mix with plain water. All right. If you don't like cold, obviously ice is not advisable because you may not dilute. Just room temperature is the best.
Yes.
Okay. Shake it well because DXN's powders is nanotechnology. So it can, if you shake for 500 times is almost like 5 minutes around there. You just keep shaking it for about 3 to 5 minutes is sufficient enough. Okay, it's a short while. It's like a therapy. Okay, shake it well and then drink it. That's it. So the nanotechnology, it will make you like water, all the powder. So it is very easy to absorb. Okay.
Okay.
Madam
Rajendra.
Rajendra Kaur. Yeah, please unmute yourself.
Rajendra, you can unmute now.
Okay. Can you all hear me?
Yes, very clear.
Yes.
Okay. Hi, Dr. Firdaus.
Hi.
Nixon and everyone.
Yes.
Good morning to all
Good
of
morning,
you all.
Good morning.
Okay. One of my friends went to visit a doctor because she's having some leg pains and all that. And according to the doctors, it's gout. But what was shocking, the doctor told her to stop spirulina. It seems that's causing the gout. So I'm a bit confused here.
Okay. Okay. This always happens. Okay. Because a lot of doctors do not know, what is spirulina actually. Okay. We are the one who is responsible to educate them, send them a couple of, research, this and that. So they may think, protein and all the same type of protein is in all this and that. Okay. But the important part is spirulina is very, very safe. Very safe. We have essential nutrition. The amino acids are so balanced. The protein is vegetable protein. Okay, it is so good. And so must take. Every gout patient must take to rebuild back all the damages happen. Okay, so don't ask me why do doctors, that doctor particularly, that doctor told them this. A lot of doctors, yes. Patient comes back to me and also they tell me, they share this to me. Okay, so it is very safe. You can see in the Google, in the research paper, in PubMed, everything, they use a lot of spirulina to rebuild back gout patients. Okay, so they may confuse, with chlorophyll, with spirulina also. Okay, with so much of things now in the market. Okay, but there is also some spirulina as cause more pain. I don't know, maybe the quality of the spirulina is not there. They have so much different types of species out there, which some patient also has told me. But when they take DXN spirulina, they do not get the pain. But when they take some other products, they get this pain. Okay, you see in China, they can get spirulina for 1,000 tablets, like 10,000 tablets. For Malaysian money, I think about like 170 ringgit, you can get 10,000 tablets or something like that. Okay, that cheap. Okay, it doesn't looks like hard, green. It looks a bit like, different color there. Okay, so this is it. Very, very safe for them to take. Okay,
Okay. Thank you very much, Dr.
it's
Firdaus.
very
Thank you.
safe. Don't worry.
Okay, thank you very
Okay.
much.
Thank
Okay.
you. Gloria.
Okay, Gloria, you can unmute now.
Oh, hello, doctor. Good evening.
Good morning.
Morning.
Good morning. Good morning. Yeah.
Yes,
Good
Gloria.
morning to everybody, and also to all the participants. Good morning, doctor.
Yeah.
Good morning. I want to ask something, and I want the reply coming from you from one of my friends.
Mhm.
She said the auntie in Philippines, she having a cervical cancer stage 3.
Okay.
Mhm.
And then she give only 1 RG, 1 GL, 1 spirulina, and then she drink with, I don't know, warm or hot water. And then now the problem of this lady now is the auntie now is the hips is now is spinning, and then the both now is blood coming.
Mm.
So I want the answer coming from you, doctor. Now I'm recording and then sending to this girl because she don't know what this one giving. I said, wait, I go and ask to Dr. Firdaus and then I will this one because tonight I got having meeting. So I want to ask from Dr. Firdaus, I say.
Yeah. Regarding this, I think I spoke to the person today. This is your downline, right?
Yes, doctor, correct.
Yeah, Lini. Yeah, Lini.
Yeah, and, yes, Dr. Nalin.
Yeah, Nalin.
Yes.
Yeah, Nalin. The one always like to dance one.
Mm-mm.
I told her she's the one who drank with hot water, boiling hot water. I already explained that to them. You see, for cervix cancer of any type of cancer is all the same. Okay. So my advice, I was telling her to increase the dosage, but apparently, affordable is another issue. So ask them to eat as much as they can. Okay. Because at the third stage or whatever stage for cancer is pretty aggressive. Okay. They need extra dosage. The best dosage is always 12 pairs of RG and GL, which is about 24 pairs, 24 capsules per day. Okay, powder will be the much best there. If they can't afford that much per day, maybe at least 6 capsules per day, RG, 6 capsules of GL, spirulina a little more. You see, and also she told that the patient has insert, okay, 1 RG and 1 GL, okay, as a suppository for that patient. And after that, it starts to bleed, okay. Bleeding can sometimes be good, okay, we do not know. So a lot of cervix cancers, they have a rupture, the tumor or the growth and all these things will start to rupture and starts to bleed and eventually will stop. So bleeding is always good.
Yeah.
Okay. But it always depends. But normally, if it bleeds by own, it will never bleed like too much. I've never seen that kind of. If for cancer, natural, if it bleeds because it's too bad, and then it's different. When you take Ganoderma and it bleeds, it's a good sign. Okay. So my advice for this patient, always tell them to take care of the food as well. Okay. Reduce the meat intake. Okay. Make it moderate meat intake. White meat is still fine. They can eat. Stop all the flour-based food, sugar-based food, milk-based food, and all these things. Ask them to go more on soupy kind of things, porridge. This will be the better thing. And increase the RGGL spirulina, and our coffee also is very good. Morinzi is extremely good for pain management, to regulate the hormonal sides, the protein side, the ATC for the cells energy, everything, ATP for the cells energy, a lot of things. So spirulina is also a best. Okay. So we are working on the nutrition side. Okay, please tell them, advise them. Cancer is something is extremely terminal and very huge, and it's very alarming. But I would not like promise or anything here. Okay, so ask them to always integrate with the hospital treatment. That is be the best. Okay, if they need to go for a chemo or need to go for a radiotherapy or whatever, it is always good to go. Why? When you give with this DXN, the chemo or the radio works much better. This is what I see. But a lot of people have this different perception. The chemo and radiotherapy is not good. It is so bad and this and that. Because you need to have a supporting for the chemo and radiotherapy. But where I give to my patients, at times you need to, like stage 4, worse than 4, it is very alarming condition. You don't have time. The time is very crucial. So you need to integrate. So speeding up, to beat the time is the biggest issue here. So obviously the spirulina, the Ganoderma will help the patient that side. And on this chemo and all will manage the cancer in a better way. Okay. So in this way, I think the patient will improve. Okay, this is my answer for the question.
So, doctor, 6 RG, 6GL, how this one, the spirulina is how many?
At least 10 to 20 spirulina per day.
Okay, doctor. Thank you so much, doctor, for the good answer.
Yeah. If anything, get the patient to contact me or communicate with me, it will be much easier.
Yes, doctor. And also, I asked also to always join and hear the meeting.
Yes.
So,
Yeah.
Yes. That will be a better, you see these meetings,
It will be a moral support to her.
Yeah, give the patient a lot of moral supports. There are a lot of other cancer patients who attend, they are, it helps them a lot. It is something they really need, this. Okay.
Okay, okay, doctor. Thank you so much.
Thank you.
Thank you, Gloria. Thank you so much for participating. So, is there any other questions you want to ask?
You see, there's a chatbot there. Joe Panir has stated there.
I think it's the same question.
Okay, there's a black blood coming out. This is a good sign. Okay, anything which is very fresh oozing out, that is a bit alarming. This black is always, the toxin-based blood. So this will be much better. So it is a good thing. Okay, so continue. That is very, very good.
Okay.
Yeah.
Okay, is there any other sharings to anyone to have and share, or you want to ask question? You can ask now. See, a lot of people didn't know about this spirulina. So today also I met 3 new new customer. So when I talk to them and discuss about their health issues, so most of them are almost 3 of them. The 3 of them also they are malnutrited. They don't have any enough nutrients in the body. They didn't think that the food they are taking. They're almost thinking that their food they are taking every day is the solution for that. So they're just filling up all the foods. They think that whatever they think that's the one who's solving the problem. But eventually, when I told them that whatever you're taking now is just a name of food, but there's no nutrients inside there. So there's one more person in the meeting there. So he's he's a testimonial there. So he told me that after I taking this spirulina, once you advised me to take more spirulina, now I see a lot of changes in my body, So I see my body is reacting very good. my bleeding in my mouth is stopping, everything is coming to. Last time when I taking just a normal vitamins, I didn't see all these changes. So this is what people outside are believing, that they are taking the vitamins, they're taking this and that, they think that they're taking all the nutrients the body needs, especially the food they are taking outside. So what the doctor says is, whatever food we are taking outside is just the name of the food, but the nutrient is not there.
Yes.
So our body is hungry for, craving for this kind of nutrients. So once you receive all the nutrients, then only the body start to work. So when the body start to work, he heal by himself. So this is what everyone should wear. So today I'm just met 3%, the 3 of them also, they are malnutrition. So I just asked them to take more nutrition, more spirulina, more coffee, more tea, all these things ask them to take. So if they take this one, continue with this, I think within a few 3 months or 1, they start to see the changes. So this is should be everyone must be sharing. So give the right nutrients to the people, let them enjoy the benefit. So the more you share to people, the more you help to people, that is where everyone should be getting healthier. And this is our work. This should be our way to do it. So we got a very good platform and very good God's giving foundation that we should help others, not just taking by ourselves and enjoying by ourselves. No, that is not shut away. We should enjoy with everyone, sharing with everyone as much as possible. Don't let the day slip without talking to one person today. That should be the way. Then only we are doing the right things. And the blessing will come out of that marvelous, I tell you. You will enjoy it for your rest of your life. This is what we are going to, we and Dr. Nemi sir, a lot of years are enjoying this. So try to do it every day. This is just a humble request to everyone. Yes, Mona, good morning. Good morning, Mona.
Yeah, you can unmute. Mona Prabhu.
Hello.
Yes,
Yes,
we
good
can hear.
Good morning.
Good morning.
Good morning. Actually, இப்போ வந்து சில பேர் நீங்க சொல்ற மாதிரியே அவங்களுக்கு ஸ்பிருலினா என்னன்னே தெரிய மாட்டேங்குது. அது மட்டும் இல்லாம சில பேர் என்ன நினைக்கிறாங்களாம், ஆதி காலத்திலேயே சொல்றாங்க, நான் பெட்டர் இந்த ஸ்பிருலினா எடுக்கிறதுக்கு பதிலு நான் வந்து கேரட் சாப்பிட்டுருவேன், நான் வந்து தண்டி கீரை இதெல்லாம் சாப்பிட்டுருவேன். அப்ப நான் சொன்னேன், முன்ன வந்து மருந்து அடிக்கல, மருந்துல இப்ப வந்து நம்ம சாப்பிடுற எல்லா A to Z வரைக்கும் நம்மளோட சாப்பாடுலாம் மருந்து கலந்துருக்கு. அப்ப நான் உங்களுக்கு சொல்லி புரிய வைக்க இதை எப்படி நான் வந்து 2 எடுக்க முடியும், 1 எடுக்கலாம், ஏன் 2 3 எடுக்கணும்? அதான் நான் சொன்னேன், நீங்க 1 எடுத்தீங்கன்னா 2 எடுத்தீங்கன்னா அதோட ஃபங்க்ஷன் வந்து நீங்க பல சீக்கிரம் இருக்கீங்க. சில பேர் டைபெட்டிஸ் இருக்கு, எனக்கு இது எல்லா சீக்கிரம் வச்சுக்கிட்டு 1 எப்படி உங்க உடம்பு அதை கிளீன் பண்ணும்? முடியாத. அப்ப நம்ம சொல்லக்குள்ளதான் சில பேருக்கு அந்த விழிப்புணர்ச்சியே வருது. அதுவும் சில பேரு திருப்பி திருப்பி நம்மள்ட்ட என்ன கேட்ட அட்வைஸ்னா, 4 சாப்பிடலாமா, 5 சாப்பிடலாமா, எதுவும் ஆயிராத, திடீர்னு நான் ராத்திரி மருந்து சாப்பிட்டு செத்துக்கிட்டு போயிருவேனா? சோ இந்த மாதிரி எல்லாம் அவங்க கேட்கக்குள்ள எனக்கு என்னடா இது, நீங்க வந்து ஆனா ஆக்சுவலி என்கிட்ட நான் பேசுறவங்க அத்தனை பேருமே என் கூட படிச்சவங்க. நான் சொல்லுவேன், நான் ஒரே ட்ரிப் எனக்கு கொஞ்சம் டென்ஷன் ஆயிட்டேன் இன்னைக்குதான். நான் சொன்னேன், மத்த இதெல்லாம் போன்ல பாக்குறீங்கல்ல, சரி ஸ்பிருலினா என்னன்னு போட்டுதான் பாக்குறது. ஆமால, அதான் நான் சொன்னேன், இப்ப வந்து நம்ம காலகட்டம் நம்ம சாப்பிடுற பொருள் சோறுலேருந்து நீங்க ஒரு சாப்பிடுற ஒரு ரொட்டியில இருந்து அதுல கிடைக்கிறது, நம்ம சொல்றோம் பாலே குடிக்காதீங்கன்னு சொல்லப்ப, அப்ப கைப்பிள்ளைங்களுக்கு பால் கொடுக்காம என்னத்த கொடுக்கறது? அவங்க ஒரு விதண்டாவாதமா பேசுறாங்க. அப்ப நான் சொன்னேன், பால் கொடுங்க, கொஞ்சம் கொஞ்சமா குறைச்சி அது ஸ்பிருலினா எப்படி குழந்தைக்கு நான் கொடுக்க முடியும்? நான் சொன்னேன், பிறந்த குழந்தை என்னோட டாக்டர் குழந்தைக்கு 1 மணி நேரம் எஸ் எ பேபி பார்ன் அவங்களுக்கு வந்து கொடுக்குறாங்க. பிள்ளைங்க ஆரோக்கியமா இப்ப நீங்க கொடுத்துட்டு வந்தீங்கன்னா ஆரோக்கியமா இருக்கும். அப்ப அவங்களுக்கு வந்து ஸ்பிருலினா என்னன்னே தெரிய மாட்டேங்குது. இல்ல நான் வேற வைட்டமின் கொடுத்தேன். நீங்க எதை கொடுத்தாலும் நம்ம வந்து DXNல உள்ள பொருள் வந்து RG GL ஸ்பிருலினா முதல்ல நீங்க எடுத்து பாருங்க. அப்ப அவங்ககிட்ட நம்ம என்ன சொல்ல முடியும்? எடுத்து சாப்பிட்டு பாருங்கன்னு தான் சொல்ல முடியும். அப்புறம் தான் சரி ஓகே ஓகே இந்த சரின்னு சொல்லிட்டு அவங்க இது பண்ணி கேக்குறாங்க. ஒரு ஒரு இதா பேசுறாங்க. அப்ப இன்னைக்கு எனக்கு அதான் நான் யோசிச்சேன். அப்ப அவங்களுக்கெல்லாம் பாதி இது தெரியாம இருக்கிறதுக்கு, நம்ம அவங்ககிட்ட போய் தான் நம்ம வந்து அந்த மருந்த எடுத்துட்டு போய் தான் மருந்துன்னு சொல்ல முடியாது. நான் சொன்னேன், "எதுக்கு ஹாஸ்பிட்டலுக்கு போறீங்க? ஹாஸ்பிட்டல் மருந்து சாப்பிட்டா தான் உங்களுக்கு கிட்னி வந்து தெரியுமா ஃபெயிலியர் ஆவுது. ஆனா இது உங்கள புரொடெக்ட் பண்ணுது. அத ஒண்ணு வந்து எப்படி நீங்க புரிஞ்சுக்க மாட்றீங்க?" ஏன்னு சொன்னோனே, இன்னைக்கு 2, 3 பேர நான் சமாதானப்படுத்திட்டு, சரி. அப்ப அவங்ககிட்ட நான் என்ன சொல்ல முடியும்? கொஞ்சம் சாப்பிட்டு பாருங்க நீங்க. அப்ப உங்களுக்கு எப்படி இருக்குன்னு பாருங்க. அந்த கழுத்து வலியா, கை வலியா, வயிறு வலியா, இந்த கால் பாதம் உங்களுக்கு டிஃபரெண்ட் தெரியும்னு சொன்னோனே, சரின்னு ஒரு நம்பிக்கை அவங்களுக்கு. ஆனா முக்காவாசி பேருக்கு யாருக்கும் ஸ்பிருலினா பத்தி தெரியறதே இல்ல. அதான் மனசு வருத்தமா இருக்கு. வேற ஒண்ணும் இல்ல. ஆக்சுவலி நான் ஷேர்
Mona.
பண்ணது இதுதான். ஓகே, தேங்க் யூ.
Thank you. Okay. So Nixon, could you translate that in English, please?
What you tell? Okay, so what is Mona is telling that a lot of people outside, most of the people didn't know about this spirulina. So people are thinking that how can we take spirulina more than one? They're thinking that spirulina is a medicine. So they are practically they're thinking that they didn't know anything about spirulina. So what they are thinking is spirulina is a medicine. So how can I take more than one capsule? I can take 5. I just need one capsule only. That's all only for that. So this is what people, conception of people is like that. They're thinking that this DXN product or anything is medicine. So you cannot take more than that. Another one more thing people are thinking outside it, how can we can give spirulina to the baby? You cannot give to the baby because baby is very small. You cannot give medicine to baby. So the understanding of people about DXN product or any other food, they're thinking that DXN product is a medicine. They didn't know this is a food by himself. So this is why this our sister Mona have tried to explain to people that this is a food. Even our doctor has given that this food to his daughter at a born at 1 hour. She given to her daughter. So even it is a medicine. How can you can give it to a baby a born of 1 hour? You cannot give a medicine like that. Because it is a food, that's why she can ever. After they explaining all these things to her, then only they try to come up with a thinking that this is a food. They try to. So what is Mona is quite. If she feel upset of that people in this kind of world still didn't understand what is the food and what is the medicine, didn't know the comparison of this. So they always thinking that DXN product is medicine, and especially our spirulina is a medicine. So this is what she tried to tell to us, to everyone, that we should educate more people to understand what is the benefit of this spirulina and all the food. We should tell them that this is a food, not a medicine. We should expose them to more and show to the people that this is only a food. So this is what she tried to tell to everyone. So humble request to everyone to share with everyone to that this is a food, not medicine. Okay.
Yeah, actually people are not aware. Their lack of knowledge, lack of education on spirulina.
Yeah.
Even doctors, okay, many doctors, they do not know about spirulina. And so this is why we are having this Zoom session, so that they can come, they can hear, they can, always people want to hear that from a doctor. So we also have a lot of video on spirulina. In DXN, we have many doctors all over the world. They spoke about this. In fact, we have a pediatrician, a doctor from India. He has spoke about spirulina for how important it is for kids. So you can download these videos, share it with them, so at least they will get enlightened on that area. Okay, this is very important. Also, we have spoke about spirulina. There is one video in Tamil and also in English. Okay,
yeah.
So please share all this with them. Okay, so that will be very good, easy for you to convince. Okay, Brenda. Brenda, you can unmute yourself. Yes. You raised your hand just now, and there's a question in the chat board as well.
Yes, good morning.
Yeah, good morning. Good morning, Brenda.
Yeah, good morning.
I just asked one of my customer that he is experiencing a frequent urination. Then I asked if what food DXN food that is fit for him, so that he can buy DXN product.
Okay, what is reason for frequent urination? It is
And the-
uncontrolled bladder or
And uncontrolled, it means that every day he experiences frequent urination. So
male, female?
male,
Male. Okay. How old is he?
48, 48,
Oh, 48. Obese, diabetic?
diabetic.
Diabetic, obese. Okay. Okay. What I would say is start him on our black coffee. That is very, very good for this kind of issues. And then RGGL spirulina. Okay. Ask him to work on losing weight if it is obese, and also on his diabetic. Diabetic is also will cause this, and I think most probably he may have some prostate problem here. Okay, so that area also, it's good to be, air handled. So powder is always good. Morinzi is also good. I don't know what is the product availability in Philippines, but RG, GL, spirulina, VCO. You have VCO, give him VCO. And Gano oil is also very good for massage at the groin and in the prostate region. That is also helpful. And ask him to cut on all the inflammatory food and, work towards healing. You see, when you have a medical issue, you have a disease, you are sick. So you need to put a lot of attention, mind, thought towards healing. You need to work on it. Okay, just don't you see, the allopathy medicines, they always have this bad habit of they think this is a medicine. So they think this is like the allopathy medication. They just eat and they will never even have a single thought about it. They may just eat and just forget about it. Okay. You tell them take spirulina 5 tablets in 2 times, and then take GL 1 tablets 3 times, 2 times. They will just eat pump. Yeah. They don't even look at the food. They don't even look at the tablets. Nothing. You see,
Okay.
You have to get your divinity through DXN. That sort of product this is. It has spiritual level. So look at it, communicate with it, love it, and then you take it, you sort of like your body will start to love it and it will start to work in a different manner. Okay, it's very powerful, believe it will work. Okay, a lot of people don't even communicate with themselves. They think, when they see in the mirror, they see just an object. Oh my God, no, you are looking into you.
Yeah.
Into you. Okay. You have to go and look into the mirror, look into the eye of the mirror. In the mirror, you can see your eye. Look inside the eye for at least 5 to 10 minutes. Non-stop. Look into what you can see, what message you get. You will feel something. You try to do it today. Don't think it's just, I've seen my face so long. It's so ugly, I don't want to see. No. It's not about beauty there. Okay, the beauty is inside, not outside. Outside you can make it beauty. You can add some makeup and make it. Look inside. Then you will get the power of communicating with your soul. If you don't you don't get the message in the first day, then do it in the next day. Do it later. Do it later again. Do it. Keep doing. And then only the flow will come. You think what you're going to see in one day, the soul is going to come out and say, hello. You never even respect him for 48 years. For 50 years, you never say hello to him. Do you think he wants to come out and then say hello to you? No. You see, that is, it's extremely powerful. Extremely powerful. Believe me. Okay, I do that. Since from small, I'm doing that. Because I had very bad childhood, so I didn't have much people to talk to. So I was like communicating to myself more. So So I find it's good. When I grew up, I read books, then I said, wow, this is what I'm doing. Oh, okay. So I am right. So it's good. So try to do and try to respect, okay. So if you all have any questions, I just need a little help from everyone here. I want you all to on the camera because I saw a new feature in the Zoom. I want to try it out. Just put all your cameras on so that I want to activate my immersive view and I want to see how it looks like. Okay. So please put all the cameras on, Don't put the camera and put the fan picture. Don't put the camera and then, a cat or dog there. I need the human picture there. Okay. So please help me. All right. Come on. Joe, I know you always will be driving. Mr. Joe? Rajendra call. Yeah, please. Yeah, okay, good. Come on, more views. Huh? I just want to check this out. How does this turn up to?
No, it will be wonderful, sir. I tried.
Alaima, look at that. Y'all can see?
Yeah.
Y'all can see the immersive view? Wow, this is like lecturing, huh?
But you need to rearrange that.
Need to rearrange, huh? Y'all can see, and
I can see. But
look at that.
There is a few.
So wonderful, doctor. It's so wonderful.
Wonderful. Look at that.
few
I
other
look
option
good.
also.
I'm the teacher here.
No, you can change the few other option also.
Yeah. Let me change the option and see. Yeah. Oh wow, very different views, huh? Oh. Walama, look at this. Wow, next time we can use this, huh? But it's the only thing half of me cannot see. Huh?
Yeah.
Okay, let me change to another view. Wow, this is look like Parliament, huh? Wow. Okay, something different, huh? Wow, okay.
I
We
think
learned
the
this today.
camera should be the option should be
Yeah,
good.
yeah,
Able to
exactly.
see a better way.
Now Dr. Firdaus and Nixon together.
Yeah, one day,
Wow. Sitting next to next. Huh?
Yeah. See, this, but not so effective, but then, okay. Look at this. Okay. It's quite different. If we put like this and do a Zoom, people will be wondering, what this was, talking from the frame.
Talking from the frames. Like a zombie ready.
Yeah. My video. Oh, okay. This is a different view. Okay. All right. Something.
The Zoom is trying to do a few options.
Yeah. Or we can also manually arrange this.
Yeah. You can
Yes.
arrange also.
You can drag and drop.
This is Parliament lah. Cabinet. Wow, look at Dr. Puan. He looks like a student.
Apa sudah jadi ni? Cold ready ya.
Oh, if you activate your green screen, you will look exactly like, I think your background will be taken off. Yeah. Wow. Different a bit. Okay. So we'll be back to our original screen. So thank you guys for putting your camera on. So any question?
Another questions.
Yeah,
Dr.
please.
And yes.
Because I can't hear a while ago because of the signal. So I will ask again if what is the dosage of the spirulina that he will take, and also the RGGL.
Oh, RGGL. For who is this?
For the customer that experiencing frequent urination.
Okay. Can starting with 3 pairs, 3 RG, 3 GL, 3 spirulina, 2 times a day.
Twice a day, three capsule of RG and GL, then 6 tablets of spirulina.
Yes, exactly.
Okay, twice. Okay, thank you, Dr. Ferdows.
Yeah. So that, and also give him coffee, the black coffee without sugar. I think that is very good for him. Yeah.
It's also the twice a day also.
Yeah, can
The
black coffee 2 to 3 times a day might be better. Okay.
Okay.
Yeah.
Okay,
yeah.
Okay, thank you, Dr. Ferdows. Thank you very much.
Sure, you're welcome. All right. If we don't have much questions, so we will end the session here.
Yes, doctor.
Okay. So I gave a last message to all of you. Okay. You see, this is my humble request from every single DXNs. You see, the biggest, the most difficult thing in this whole world is death. Death is something that is very difficult to accept and to go through and to face. Because something that we love, we cannot let it go just like that, especially our loved one, and which is unreplaceable. Okay. For husband to lose the wife to lose the husband, the kids, the children to lose the parents, it is so devastating situation. So please put a lot of attention to build a good health. At this point of time, what we need extremely a good immune system to battle these variant types of COVID. How long? Okay, so please, okay, everyone's cooperation, understanding is needed. Okay, at one point of time, every single one will get this exposure to COVID. Definitely, that's for true. That's for sure. Okay. I've lost quite a number of friends, doctor friends, very good friends, and so on. And now there's so many people's house has COVID already. So many. And I think about 20 to about 30 over people is in the quarantine center. Serdang, here, there, every call's coming in, terrible calls. You listen to the voicemails are so sad. Why? Because of lack of knowledge, negligence, taking things lightly. I may not get it. No. There is no such thing you may not get it. You will get it. Unless you're not going to go out the rest of your life after this. That's not going to happen. Okay. The vaccination, everything, all this, go and get things done. And if you vaccine or you don't vaccine, that is your own preference, but work on your immune system. That is very, very important. Work on your immune system. Have a good immune system. That is what's going to help you. So take care of your family, take care of yourself, take care of your kids, take care of your friends. Pass all the message to everyone. Okay, be a bit hard and rough to them. If you love them more, then you have to knock their head and tell them, how important it is. So just don't lose it just like that, and just don't leave and go. Okay, this is very important. So we have DXN. DXN is there to give you the best health So that will really, really help you. What are the best for now? RGGL, spirulina, Androgy, Spica tea, honey. The rest you can add whatever you want. All is good. Coffee, black coffee. Okay, everything is good. Dr. Puan, please unmute.
Yeah, sorry, because you said it was your last words. Then I suddenly remembered something.
Yes, please.
Now, good morning. There is a question from someone in the chat box. Maybe you want to refer to that later. I just wanted to say something about the importance of doing sunya meditation during this time. Because as you said earlier, looking at your face, your own face, and you start talking to your soul. So sunya, by doing sunya practice, a lot of anxiety and a lot of this negative thoughts that is being bombarded, by through media, just discussion with people, all that can be dealt with in a very, very simple and effective way. So I encourage every single DXN member who has done sunya practice, please get your families together, sit down and do the sunya practice with them. Even if you complete the 9 to 0 count, it is going to be extremely helpful for them.
Yes.
I think it is very important.
Yeah.
Dr. Lim has introduced, something very, very powerful. And also there are some, like pre-exercises, they call it pre-meditation exercise, just the swinging of the arm, swinging of the arm right up to the shoulder length and then dropping it. Even if you do, if you have any aches and pains in the body and you do it 1,000 times, you can spread the 1,000 swings throughout the day. You find it is amazingly effective, really, really effective.
Yes.
Yeah. So please do these things. Like I've been having a lot of requests to do meditation from so many groups. So I am doing them even with India. Youngsters, professionals. So many groups are requesting. Because they hear about it and they just want to know how to do it, and they just come online. Half an hour and then they do it. I think those already in the group who know how to do it, please, this is your contribution for the mind and the body to be aligned so that everything possible that needs for them to be kept healthy will happen. Yeah, thank you very much.
Thank you so much, Dr. Puan. That's in fact very true. Okay, sunya therapy is a mind to stabilize and to recharge, to discharge all the negativity. At this point of time, everyone is extremely stressed and everybody is so fearful, so scared. Okay. And, there are so many groups, when I aim, this is what they talk about. They talk about, this, that, there is no easy way for you to out from this condition. Okay. If you are not healthy, if you are not having any good immunity problems, and you're having a lot of disease, diabetic, hypertension, blah, blah, blah stuff, you're taking a buckets of medication, and there is a single medicine could come and help you out of COVID. No, there is no such thing. Okay. And this is what people are looking for. Okay. It is, no. You eat this, then you cannot get COVID. There's no such thing.
Yes.
Okay. No such thing. There is no easy way out for you. Okay, there's a price for everything.
Yeah.
Okay, so what? Your immune system, that fella is the best fella. So how are you going to build him? You have to give him good care.
Yes.
That is the fella you have to look in the mirror every day, talk to him, feed him, take care of him, love him, love him. That's very important. First, you have to love yourself. There's so many people do not ever love yourself. Never even spoke to you. At you. Okay, look into mirror, smile. Wow, you look handsome today. Yes, this is very important. You will get the answer. So smile. Give him coffee, give him spirulina, give him RG, give him GL, give him everything. Let him rock. And that's where you will be saved. Okay, so you have the best doctor in you. So make sure the flow work and build him and get everything what you want from him. And the Sunya therapy is for you to clear all your baggage, the negativity in your head. Okay, so I guess we are already there.
Yeah.
All right, Mr. Nixon.
Yes, doctor.
Okay, so thank you, every single one of you to take part. Okay, today we didn't have much question, so we will end this session here. But whatever we spoke today and we learned today, it is extremely important and good things. Okay, so keep yourself safe. Okay, build your immunity with DXN. And I will see you on the next session. From next week onward, and every Zoom, we're going to start dancing. So to this week, it's a bit like, bump and hump here and there, some death and funerals and all these things. So I was not able to shake well. So we'll be back on track to this next week. Okay,
All right.
so 30 minutes or 45 minutes before we will come. You see, it's not for whoever wants to let go, relax yourself, come in. Who think the dance is too long, you may dance for 5 minutes, rest, and then dance for another 5 minutes, rest. No problem. Nobody is putting here, a fixed tag that you must dance for 45 minutes. No. The one who can dance for 45 minutes, okay. The one who wants to come 1 hour early also is fine. Okay. The one who wants to dance for 5 minutes also is fine.
Yeah.
Or you want to sit and watch also is fine. Okay. So thank you so much. Thank you for all the co-hosts, Nemi sir, Mr. Nixon. So all
Thank you very much. Thank you, one and all.
Yeah, all the participants, everyone.
Take care. Stay safe.